morning and welcome to the webinar. I'm Randy Wehner, and with me is Liz Wilson. She is our National Sales Executive, and together, her and I will be facilitating the webinar. Liz, it's really great to have you on board, and I am looking forward to not only having your help with our webinar today, but also having your assistance on future type webinars coming down the road here, so to speak. Looking forward to having your help. Welcome.
Thank you, Randy. Glad to be joining.
All right, very good. So we're going to go ahead and advance and keep time frame moving here, and we're going to go ahead and get right into what makes level funded plans work. So let's go ahead and get the next screen. There we go. So we're really here to talk about, and I kind of get a humorous kick out of really looking at our graphics here on this, that we're talking about the nuts and bolts of the funding advantage, the pieces, the parts, so to speak, of really what makes it work. How is it helpful when you're connecting with your clients to talk about the funding advantage and the benefits that are associated with it. So to answer that question, what makes level funded plans work? First of all, we believe that overall employee and dependent health is really crucial. Now, we realize there's not a perfect group out there health-wise, but certainly groups that might have some high major medical issues that are at work right now. Maybe there's high-end drug utilization that's going on. Things that you might know about the group right now is always helpful, because knowing that the group has got moderate health issues or less than moderate health issues then is an opportunity for the group to be considered for a level funded plan group here. Also, it's important to have a realization of knowing what the healthcare consumption patterns are in the group. For example, are members seeing a doctor each year for their annual checkups, or are they utilizing a lot of emergency room care, or are they using quite a bit of prescription drug medications as well? Having a feel for what is going on in the group certainly can be of a help to you as the agent when you're considering a level funded plan. What are the consumption patterns of the group? And then good plan designs can lower consumption. So the more you kind of know about what and where the cost can be in an employer group, knowing that will help you to think through the designs of the deductible, the co-insurance, and there's a lot of, not a lot, but a significant amount of tweaks that you can make to the plan design to make it attractive not only for the employees, but are going to be helpful for the employer from an affordability. Change the course of some consumption, it's going to be in a better situation for the employer group altogether. And then also long-term financial stability and commitment for the plan year is critical. Really, on the funding advantage, this is a group health plan that needs to have the employer's commitment for a 12-month plan year. It's not the type of plan to join on and then a few months later jump off, as you can do in a fully insured marketplace, as this is a plan that really the employer needs to stay on the plan year. So to show you the parts of the level funded plan, let's go ahead and move the next screen, and let's take a look at really what we talk about as the cost for the funding advantage plans, which are divided into three categories. The very first one you see on your screen is the claims fund. Now, this is established via medical underwriting. Now, it's a part of the monthly payment the employer contributes to the claims fund. And it can range from, on the low end, as little as maybe 25% for small groups, and for larger size groups, that claims fund contribution can be as much as 50% of the monthly payment that the employer makes. So that claims fund, again, is determined through medical underwriting, and that's what makes level funded work, because level funded is the type of self-funded product where the employer's risk is capped. We're going to talk about that in just a moment with the claims fund as well. So the next is the stop loss insurance. So there's actually two types of stop loss protection that come on this level funded plan. The first is called specific stop loss, and this is referring to specific claims. So maybe John Doe had a appendectomy. That would be a specific claim for that surgical treatment, or a hernia operation, or a cardiac issue, even a, God forbid, a cancer issue. Those would all be specific claims. And so there's stop loss protection to help minimize the risk for an employer. So I was saying we call level funded in such a way because the risk is capped. So in the claims fund, the employer is not at risk at 100% for all the specific claims. So there would be a specific, what we call attachment point in the claims fund, where the claims dollars would be paid out for a specific claim. And then the stop loss insurance, once they reach that attachment point or that specific deductible of the mechanics of a specific stop loss protection, would then pay the claim at 100%. And there's also aggregate stop loss. Now, aggregate stop loss is once all of the dollars in the claims fund have been exhausted sometime in the plan year. If that does happen, then the aggregate stop loss steps in and starts paying all the claims at 100%. So specific and aggregate stop loss come with the plan, and that's a really nice feature because this next point talks about aggregate accommodation, which means that any month there's insufficient dollars to pay claims, of course, after the employer's made their regular monthly payment, premium payment. Once they've made that payment and there's still insufficient dollars in the claims fund, the stop loss carrier automatically advances dollars seamlessly into the claims fund, so there's always going to be sufficient dollars to pay claims. So when you think about it, all the employer really has to be concerned about is just making their regular monthly payment. Then the third part of the process here, or the parts of the funding advantage as we call it, is the administration and sales cost. Finally, this results in Allied's cost, and it's roughly about 10% or less of the total monthly payment. It goes to pay you, the agent, compensation. It also generates reporting, so both you and the client have a good understanding of where all the dollars are going towards you. So you get a monthly claims report to see the flow of the dollars coming into the claims fund and the flow of the dollars coming out of the claims fund as well. And there's also a quarterly utilization report that will show you where the dollars have been spent, what categories such as office visits, prescriptions, inpatient care, outpatient care. We're not ever going to violate HIPAA rules, of course, and share names of individuals, but there will be some really simplified reporting that helps you as well as the employer make the right decisions on the plan designs, especially when the renewal comes up, because you will have had a good year of getting at least 4 quarterly utilization reports to show where the dollars are being spent. Very helpful, especially for a lot of groups that are under 100 lives, in some cases under 50 lives, that have never had the access to see where their dollars that they're spending in a fully insured market, where those would go to. And here on a level funded plan, you can see that happening consistently. Well, we're going to get to our next slide, to where Liz Wilson is now going to review the types of level funded group health plans that are available. So Liz, we'll turn it back over to you here, okay?
Wonderful. So this slide is great at illustrating the 4 main plan designs that you have access to through Allied National. We have our standard PPO plans, our freedom plans, which is our reference-based pricing plans. We've got the cost saver and direct primary care. What we are really excited about this year as well, coming out in second quarter of 2022, Allied will be offering a new hybrid RBP PPO plan. This is going to be a wonderful new product that some of you may have used before with other carriers or just heard about in the marketplace. And we're bringing a product of this type to the market as well, because we think we can do it even better. Our RBP plans are successful, and we have a huge, fan following of these plans. But to introduce the RBP concept to more agents, more companies who would benefit, we're giving you the option of a RBP PPO hybrid. So we'll talk about that more coming up. But yes, this slide just kind of introduces what we're going to be talking about, going over each of the plans, starting with the PPO. Our PPO plans are traditional PPO style plans with a variety of deductible options starting at $500 going up to $10,000. There are multiple copay, coinsurance, and out-of-pocket options available with each deductible as well. And we do have a very useful tool. I'll kind of refer back to Allied National's website a few times because we want to make sure that our agent partners and our client members are utilizing our website to their advantage. It really is there as a tool for you, more so than just a general kind of marketing piece about Allied. You can go in and find an in-network provider on a tool on our website. So if it is important to the member to make sure they are working with an in-network provider for a PPO plan, this is a great place to start. Of course, someone such as Randy and myself could always be of help as well. We utilize the Cigna network nationwide and a variety of other regional networks such as First Health and PHCS. So, of course, if you've got a client who is passionate about PPOs, Allied National can always be of help.
Well, Liz, I'm going to go ahead and step in for a moment and talk a little bit about reference-based pricing, because it's a logical transition to talk about the PPO plan, and that's certainly a viable option for you. But Allied has really had some great experience in utilizing products here for level-funded group health plans without a network. You know, it used to be, Liz, you probably remember as well, that back in the 1990s and early 2000s, that there were still a number of group health plans that were sold without a network. And as the PPOs started to grow, HMOs started to grow as well, they really began to take off. But it's really nice in today's day and time here, so to speak, to be able to offer a plan that doesn't have a network, to not have to worry about if a provider is inside the network as well. So we refer to our plans without a network, we call them the Freedom Plans. So we're going to talk briefly about that. And really one of our signature plans, of course, utilizes what we call reference-based pricing. So this is where members receive the value of a PPO-like discount for medical services. Now, the plan actually reimburses providers by using what we call Medicare plus accepted payment levels as a reference point. And really, Medicare becomes the reference point. So we're not attached to Medicare at the hip here, per se, so to speak here. We're just utilizing the scale that Medicare is going to pay out in benefits. And already, so many people in the United States are utilizing Medicare, Medicaid for that matter as well. So it's already an accepted piece with many, many providers because they're already having members that are using Medicare services. But we're actually going to use it as a reference point from which to make a provider payments. And it's really very easy. Here's how we pay it. So it's for the Freedom Plan, it's going to pay physicians at 125% of Medicare allowable reimbursement. And then for facilities, it's very simple, at 150% of Medicare allowable expenses. So Allied is going above what the Medicare scale is to pay benefits because we want to pay what's referred to as a fair and reasonable rate. And on the ID card, it actually states these percentages are actually on the back of the card. So the provider knows what we're going to pay. Plus, we provide on the ID card what we call a sleeve, kind of a cover for the ID card. And that also can be used to help providers reach out to Allied should they have a question or should they want to verify benefits. So that's really a great piece about the Freedom Plans. And believe it or not, and I always have agents that are always surprised when I say this, close to 80% of our block of business of group health insurance is using the Freedom Plan. So it's been successful, and obviously the rates are a little bit less, roughly about, they can range from maybe 7 to as much as 15% savings going with a Freedom Plan without the network. So I'm going to turn it back over to Liz, and Liz is going to talk a little bit about our Cost Saver product.
Thanks, Randy. So as Randy was saying, yes, our RBP Freedom Plans are our most popular. However, I think Randy will agree with me when I say, please pay attention to our introduction to you to the cost saver. The cost saver is, I think, currently underutilized from Allied National, and that may simply just be because you don't know enough about it. So we'd like to really highlight this for you and share this plan as an option. The cost saver is a unique low-cost group health plan for employers who are basically priced out of the increasing cost of traditional major medical coverage. The cost saver provides office visit and rich outpatient benefits like a traditional major medical plan and scheduled cash payments for surgery and hospitalizations. So the cost saver is again a level funded funding advantage plan, but it uses major national PPO networks that are contracted specifically for this plan. So all members always receive the valuable PPO discounts for services. What's more, and makes this a great option for a lot of groups, is that there's no medical underwriting, and it is accessible for groups sizes 2 or more full-time employees. So list enrollment is available. It makes this very seamless, easy to access, and very affordable for groups that either maybe need to stair step into providing major medical coverage and they're looking for the most affordable option possible, but still providing really fantastic benefit for their employees. Or it may be a tier situation where a certain group of employees receives the cost saver plan. There's a lot of ways that we can work this cost saver into being better utilized, so definitely don't hesitate to talk with an Allied representative to really figure out which of these plans is the right fit for the group you're talking with. A few more details about the cost saver. It provides 100% coverage for preventative care, so it meets minimum essential coverage requirements for all ALEs subject to the Affordable Care Act employer mandate. And the new bronze MVP option meets minimum value requirements for ALEs as well. So just a reminder, the cost saver, take a closer look at it. Feel free to give me a call to discuss. There's more information on our website. And then next, I think Randy is going to talk more about direct primary care.
That's right. Liz, I'm going to add on just a note, too, about the cost saver that I really like. I think this is a great product. I'm working with an agent right now on a cost saver plan, and it's kind of interesting, Liz, because the agent started showing a major medical plan, and the employer right away was communicating, I can't afford these major medical plans. And she even said to the agent that I've had other agents talk to me about major medical plans, and I've got a really tight budget to where I just cannot really adequately provide and contribute enough towards a major medical plan to motivate employees to be on the plan. And so he made the suggestion of the cost saver and mentioned about the bronze plan as well. And boy, the whole conversation just turned wonderfully positive, and she said, I'd be very interested in a limited benefit plan that could cut my cost maybe 40 to 50% less. And so she's, in fact, filling out information right now to go on a cost saver plan one plan. She said that is affordable for us, and looking at the benefits, it's got a lot of the major benefits that a typical major medical plan has that members like to get access to. She said, I've got employees that need to make office visits. Well, this comes with office visits. I have employees that want to get prescriptions. It's got generic prescriptions on the plan 1 and 2, and on the plan 3, the bronze, it's got brand discounts. So a lot of fun things, if I can use that word just for a moment, a lot of good things per se that are on the cost saver that are available without asking any medical questions at almost half the price of a major medical plan. So I always like and enjoy and appreciate when an agent gets the idea of the cost saver, how it can be a tremendous plan to offer. So I had to add that in. I hope that's okay, Liz.
Absolutely. Great ad, Randy. Thank you.
All right. So we'll talk about our direct primary care here for just a moment. We're not going to spend a lot of time on this, but this is really just something to kind of highlight for you to be aware of here. So it's really a new type of healthcare delivery system where members subscribe to a monthly fee with a doctor. And the whole goal of direct primary care is to give employees, members, direct access to their doctor. It really is a neat way of a member being able to quickly access by way of a phone call their primary care provider that happens to be a direct primary care provider, and they have, that is, the members would have access to that doctor 24 hours a day, 7 days a week. And from what I understand, when you reach out to your direct primary care provider on the phone, you don't get an answering service to answer the phone. The doctor actually answers the phone, even if they're on a vacation and you're needing to access that doctor is on call with you for that monthly fee that you pay. So it's a unique major medical plan that we offer that becomes a wrap plan that supports a relationship with members' direct primary care physicians. Now, this eliminates duplications of services and costs. So it coordinates all of whatever was with the PPO or Freedom Plan with, we kind of call it an acronym here, DPC, Direct Primary Care Provider. Plus, it reduces costs significantly. When you look at the major medical plan wrap, there's no need for an office visit category because that's going to be met with the direct primary care membership where you'll have office visits of unlimited capacity. And sometimes even the direct primary care providers can dispense meds. So a lot of times we can cut out some of or a significant amount of the cost of prescription drugs as well. So it does reduce costs significantly. And it also helps promote improved health because when a member is talking to their doctor about a health issue and getting an opportunity to explore options that are going to improve that health, that's always a win-win. And so it circumvents possible major medical costs later on, and it helps get a member on the road to better health as well. So if you have further questions about that, you can always reach out to our sales team here at Allied National. We're more than happy to assist you with questions or even a quote if you have a connection with the direct primary care provider. So Lisa, I'm going to turn it back over to you, and you're going to talk, it sounds like, about HSAs.
Yes, I am going to talk a little bit about the HSA option that an employer can sponsor a plan that's compatible with all HSA tax rules. So we were familiar with the high deductible plans that allows you to put pre-tax dollars away to pay for major medical coverage. In addition, you see on this slide the hybrid RBP PPO plan that we're trying to promote as an option for major medical coverage as well. As Randy was saying, the RBP plans that Allied offers are our most competitive major medical price-wise, but the hybrid PPO RBP option is going to kind of offer a little bit of both. So you've got the RBP savings with facility costs, and you've got the PPO network security when going to meet with providers. So we're seeing this as a great option for employers who are really attached to the PPO plan, but they're really looking for a more competitively priced option and want to get introduced to RBP. So coming in second quarter of 2022, we'll be offering this. The price point will be maybe 2 to 8% higher than our standard RBP, but certainly still a lot less expensive than the traditional PPO.
Well, Liz, I really get excited about this hybrid product here. I think that it's going to really offer another advantage, another product that the agent can have in their back pocket here, so to speak, to make a recommendation to a client that I think can really help resolve an opportunity to make a sale utilizing this concept of a hybrid model. So I'm looking forward to this being rolled out, aren't you?
I think we all are. We're very excited about it at Allied, and so far the feedback that we're receiving in the market about this being an applicable plan that groups are really interested to take a look at is there. So again, it's an option for us to quote all of our plans for you, or kind of just talk a little bit more in depth as you are getting to know the group or looking at renewals and just trying to figure out what's the best path forward based on each group that you're working with.
Great, great. Well, another product we're going to talk about right now is called the Freedom Essentials. Now, this is a relatively newer product with us. Probably in the last year, we've really just rolled this product out. And this becomes a plan option that requires an additional feature to be added, which we're going to talk about in just a moment, called Health Choices. And by requiring this feature to be on, it's automatically going to reduce the cost of the major medical plan by about 6.5%. Now, that's nothing to shake a stick at. Very nice to have a nice, well, you can also call this Essentials, as a nice economical group major medical plan. So it is going to require that you have access to the Health Choices benefit, and it does exclude Tier 4 specialty drugs. So Essentials offers substantially lower cost than the popular Freedom traditional plan that we were just speaking about. But you might ask, so how is this a benefit to take out a Tier 4 specialty drug coverage? Well, for one, by taking it out, it really does obviously reduce the cost of the plan. We believe by as much as 10, sometimes as much as 15% less. And by taking it out, now the member has an opportunity to qualify for either a substantial manufacturer's rebate or manufacturer's discount. Because there's no coverage, then the member has the opportunity to qualify. And what's great is that when the employee has to have that Tier 4 specialty drugs, they can reach out to My Healthcare Assistant, which is actually the same line as the Health Choices line, by the way, here, and they can state to the nurse, it'll be a nurse specialist that they'll talk to here at Allied National, and once they have that need for a Tier 4 drug, we'll help them and help them assist them through that qualification process to qualify for the substantial discount or the rebate. So it's not like we just say that something's available. We'll work to try to help that member with the qualifying process to secure a discount or rebate if available. And plus, I just had mentioned a moment ago, the Freedom Essentials includes the Health Choices feature as well, and we're going to talk about that right now as we turn the slide here as well. Really about 2 years ago, Allied introduced Health Choices as an add-on feature to our Funding Advantage plans, primarily to our Freedom traditional and major PPO plans here as well. So it's really like offering a free second opinion on health issues such as diabetes, obesity, mental health or substance abuse, maybe an image scan or a Tier 4 drug, as I was just talking about, upcoming surgeries or treatments. The Health Choices benefit option provides Funding Advantage members with an immediate monthly premium discount of 6.5%, as I had just alluded to a moment ago. If members use certain services, the benefits and care really are what we call greatly enhanced, and Health Choice members can take advantage of benefits by working with the Allied Healthcare Assistant. So it's a simple phone call that the member is really asked to make, and overall the goal is to improve, again, the member's health, and also to reduce cost to the employer by hopefully stopping or preventing or making it a less impactful cost for a future medical issue that through Health Choices might be improved upon or could also be cured possibly. We always like to think that that's always that opportunity, but Health Choices is all about offering a second opinion, and with that an opportunity to take advantage of those opinions and be rewarded for taking advantage of those options as well. And by preventing health claims early before they become problems later on. So it becomes what we like to think of as a win-win, to where the employee's health or their dependents' health can improve by utilizing Health Choices, and it's a win-win for the employer again because it helps prevent possible major medical issues later on the road that could have been a problem by attacking it through this process, if I can call it that, through the health choices of being able to minimize the health issue at that time at all possible. So it becomes a win-win. And also for the member, such as, let's just give an example here, maybe for a diabetic issue, you take advantage of the ideas that we make a recommendation for. Maybe it's another type of a treatment, and we connect you to a doctor, and you like what we're doing here. Well, we'll provide free testing supplies as a reward for you. Or if you had a mental health issue, we might waive some of the office visit costs that are associated with mental health. We'll reward you for taking advantage of the second opinions that we offer. Of course, there's no demand that or requirement that you take advantage of the second opinion, but wow, can the second opinion really offer some tremendous help to an employee? Absolutely, it definitely, most assuredly can. So that's the health choices piece. We're now going to talk about reporting. I'm going to turn that back over to Liz. Liz?
Yes, I think, Randy, you touched on this for a minute at the beginning of our discussion, and that is the functionality of reporting with Allied. Allied is extremely transparent on how our plans operate, dollars coming in, dollars going out, and all this information is readily available to everyone involved. So a few ways that this is accessible: we do have a portal that, as an agent and an employer and as the members, you are able to access, set up your group so that you can go in and track everything that's going on with your group's utilization, accounting, etc. Again, like Randy noted earlier, we do respect and adhere to all HIPAA regulations. This is, private information is not shared, but in terms of kind of bookkeeping and financial accounting, you're able to see everything coming in and going out. So the accounting statement, this is a statement showing all the employer's payments to the plan and how these payments have been allocated between the stop loss premium, administrative fees, and claims fund contributions. So this is something that is also proactively sent out. So while I'm talking about the portal that everyone has access to online at their convenience, Allied also does send out monthly reports. The claims utilization report is provided to the employer. It's a high-level, easy to understand picture of what services are driving benefit costs. So you get to see what claims are being paid each month and plan year to date. You get each quarter a detailed utilization report about those claims paid, allowing the employer to fully track claim fund dollars and where they're being spent, whether it's office visits, prescription costs, hospitalizations. And it also then gives us a chance to work with groups to understand where we might be able to do some education. Maybe money can be saved by looking for non-preferred brand name drugs that should be switched to brand name drugs or vice versa. There's a lot of ways that these reports can help us be more knowledgeable and proactively work to drive down the costs of the major medical coverage that groups are providing. This benefits everyone involved. So these reports are significant for both transparency and education. We never want an employer, a business owner, or an agent to be wondering what's going on with the performance of a group. It makes the renewal process a lot easier as well because you have some idea of what's coming. I can't tell you how many times I've actually had the conversation that a group doesn't understand why they're getting money back. So it doesn't happen all the time, but it has happened. So making sure that as an agent, you are letting the group at the business owner as well as the member know that information is available to them at all times, and to have that conversation maybe a few times a year with your groups about what's going on based on the reporting that you're able to look at together from Allied National.
Liz, it's really a nice feature for an agent to understand what drug costs are. It's always kind of an unknown to an employer what does ABC drug cost? What does EFG drug cost? And this and that. And what's nice about the utilization report, which is a quarterly report, is that you can see what is being spent on what drugs. Now, again, I'm not going to violate HIPAA here or say who it is, but you certainly have a good feel for what prescription drug costs are. And that's oftentimes overlooked because sometimes the members and the employers see just the copay that they're paying and think, well, there's no other additional cost beyond that copay. And then when they see this report, they think, wow, there's a lot more cost than I realized here. It really helps educate an employer, especially, to understand the cost behind the cost overall for group health insurance. So it's a neat feature to have that, and many of an agent I've spoken with always appreciates looking at this. In fact, Liz, this reporting is available on the Allied self-service portal as well. So it's real easy to gain access to have access to the reports, both the monthly and the quarterly utilization report. Well, I'm going to talk a little bit about the claims fund and the run-out period. Again, a little bit of the nuts and bolts here of this process. I want to keep in mind that after the renewal, there's what we call a 9-month period remaining to pay all claims that were incurred during the 12-month initial plan year. So if you started a group on January 1st, then you would run the full 12-month time period. Obviously, throughout the year, claims are being paid if there's claims being generated, but always there's some claims that don't always get paid. Maybe they're late in the year as far as when a employee or a dependent has any type of a service provided, or the provider is just delayed in getting the billing out. And so a special 9-month period is what we call the run-out period to pay all the remaining claims that were incurred during the 12-month plan year. So we really call this plan, a little bit of lingo here for the agent, we call it a 12-21 plan. 12 months for the plan year, plus 9 months for the run-out period. You add the 9 plus the 12, hence we have a 12-21 plan. And then after the run-out period ends, at the beginning of the 10th month following the 9-month period, the 10th month, we'll balance the account, and then we'll begin to process if there's money that's remaining in the claims fund, and we'll write a check, and we'll send a check back to the employer for all the remaining dollars. I'm going to add to this, 100% of all of the remaining funds in the claims fund go back to the employer. Now, this is a really big difference with our product compared to other competitors out there that will simply maybe only pay with some strings attached. Maybe you've got to renew to get any type of refund back, or maybe you only get a certain part back if the group has had a certain level of dollars that are remaining in the claims fund. Just some different strings that are attached to it. With Allied, our refunds are 100% of the remaining dollars in the claims fund. And that's really attractive because when an employer sees that they've got surplus money left in the claims fund, they want that money back. And that's really a neat feature with the way our level funded plan works. The funding advantage is that we refund 100% of the dollars in that claims fund. Roughly between 40 and 50% of all of our groups do receive a refund. And that's also a key difference maker because we underwrite with the purpose of helping with the highest degree of possible likelihood available there that a group would receive money back. So there's also what we call an employer protection from run out up to 36 months. So even if a claim does surface, we've already paid the remaining excess dollars back to the employer. That run out period is over with, and we've paid dollars out for the balance that was left over. The employer is protected against any additional claims beyond the 9-month run out period up to 36 months. So that is a great amount of time to protect the employer. Well, I'm going to turn it back over to Liz. She's going to assist with a key piece of underwriting and submitting your groups to Allied National. Liz?
Okay, so yes, this is key. If you have not worked with Allied before, Know that we are trying to make it as easy as possible for you to submit groups for quotes and, of course, get them enrolled. If you have worked with Allied before and you have been through the quoting process, you may know that we've had a little bit of an update this last kind of maybe 6 months regarding groups 20 lives enrolled and up. So I'll kind of outline this for you real quickly on how the underwriting process works depending on the group size. So for 2 to 19 employees enrolled, it's going to be a fairly standard underwriting process utilizing individual health applications, health questions. Of course, we need census information. We're going to have health applications completed, and we are going to underwrite to the best of our ability, like Randy communicated, to potentially give the group an opportunity to have something returned to them at the end of the plan year. And then the 20 plus groups, this is what's new here at Allied. So we've implemented Gradient AI, which is a tool for underwriting groups 20 lives enrolled and above. So it is census-based. We're going to need a completed census with all full-time eligible employees and their dependents. And with that information, we're able to take a look at the group and a little bit about the performance of the group, utilization, pharmaceutical usage, etc. And with a census alone, we're able to turn around a firm rate on the group. So while we do still do some type of application, it's different. You're getting a firm rate upfront based on the census, and then for the group to proceed, we will ask them to fill out a quick knockout application. The knockout application is basically 5 health questions, just double checking to see if the Gradient AI did not uncover a major medical condition within the group that would have the group be unable to proceed. So you've got the census submission and then the potential knockout applications to proceed. But the rate does not change. The original rate provided to the group is what holds firm. Of course, we're going to ask if we can get current plan designs, rates, renewal rates, and even a recent carrier bill. The more information you can provide us, we're going to use to try to be as aggressive as possible upfront. We want to get your groups enrolled with Allied National. We want to have as much information as we can to get as aggressive as possible. This 20 plus new underwriting opportunity just allows us to streamline the process for you, making it a lot easier. And you can get a firm rate in front of your client without having to ask the employees to go through a standard health application. The knockout app is only requested after the fact when this is a group that wants to enroll. And participation, just to confirm kind of the participation requirements for our groups, we are a 50% participation requirement excluding waivers, or 70% participation including valid waivers. So I know there's been question about that, and we just wanted to put that out there too regarding what's the participation requirements at Allied National.
Well, Liz, we've reached our time period here. We have had a great session here, and we want to really take some time just to say thank you for joining us on the webinar today. And you will see not only our pictures there, but you'll see our telephone numbers as well as our email addresses. And we want to encourage you to where if you have any type of groups that you would like to get a quote on, we would really love to have the opportunity to roll up our sleeves and generate some quotes for you and show you how these plans can work. We want to really thank you for taking your time to watch the webinar today and to join in, and we look forward to helping you succeed in marketing group health plans from Allied National. Thank you very, very much.
Thank you, everyone. We look forward to working with you.